Hello everyone, this is Badillo, recording week 3, organizational systems, the skills needed to successfully manage. The organizational module for my work is a horizontal model. The advantage is that it's less unyielding control-wise and has more flexibility for staff. Another advantage is that the manager leader is able to streamline communication with the managerial leadership staff because there are less levels. Unfortunately, the negative side is that the manager/leader may have other departments or responsibilities which may hinder with being available for staff. I feel indifferent on which organizational model I would prefer. The vertical organizational model decreases the span of jurisdiction and has less levels of managerial/leaders. This allows for the manager-leader to be more involved within the department, which is a positive aspect. Grower, Murray, and Langen 2011 illustrates that the manager's success is contingent on a person's talent, motivation, and opportunity to manage. The leadership skills questionnaire result is that I am evenly 27 in interpersonal and conceptual skills, and not far behind the administrative skills 29 level. I score lower in the administrative skills most likely, though I want to impact institutional outcomes. I truly do not enjoy paperwork. Conceptual skills helps with mentally visualizing factors which are interlinked, thus helping determine decisions such as staffing needs. Interpersonal skills enhance cooperation, empathizing, motivating, and leading others. In turn, promotes buy-in and unity. Staff issues are difficult to deal with when no resources are available, especially during an immediate nursing crisis. One of the skills I will use is planning, conduct industrial engineering study and hire appropriately, creating staff plans/schedule reflecting workload, delegate scheduling to staff, and utilize the staff float pool. Fairly and ethically, maintaining ethical standards. Directing, supervising, motivating, and communicating will help with staff retention. Coordinating with human resource and other departments of staff needs is essential to fulfill staff shortages. Overall, manager/leader should reflect the ANA scope and the standards for nursing administrators. The article I read was Transdisciplinary Coordination and Delivery of Care by Scarlett K. Mueller. The focus is collaborative care of cancer patients using transdisciplinary care model. Currently, there is not a fully established transdisciplinary care system. There is more of a multidisciplinary model. The article explains that the plan of care is jointly developed using each discipline's evidence-based expertise to determine goals that are synergistic and not redundant. The medical, nursing, and ancillary disciplines to include pharmacy, rehabilitative services, nutritionists, behavioral therapists, social workers, massage therapists, acupuncturists, community resources, and even information technology become part of the transdisciplinary team. My conceptual leadership skills will contribute to the vision of how to transition from multidisciplinary model to the transdisciplinary model. My interpersonal skills will help with influencing and motivating others. The article would help with expressing to the health community and others involved how important it is to collaboratively care for our community. The levels to address are, of course, the board of directors, the president and CEO, the vice president of the patient care, the medical staff, finances, that can do a cost analysis, human resources, maybe some staff requirements there. Also would involve the hospital foundation. They probably could help with additional needed funds. The departments to work with would be the pharmacy, to include the local pharmacies if possible. I would include any department that a patient would come in contact with, definitely. As far as being effective in my role, I will work with all departments that have anything to do with finances, supplies, engineering, information tax, patient care, and with any managerial leadership level to, of course, make the place a better place to work and better for the patient. Well, thank you. Have a good night. Talk to you soon.